So there's four kind of topics that we're going to go over. One is MRI, is it worth it or not? Then we're going to go into why medications and injections don't always work, and kind of understanding how you would know if something like that was going to work or not. And then we're going to get into what most healthcare providers miss. So we'll go into some of that. And then why surgery, especially with the back, why surgeries can lead into 2 and 3 other surgeries with the back. So those are kind of the 4 topics that we're going to cover. So the first one, MRI. So many people put so much value in an MRI, thinking like the MRI is going to show me exactly what's going on. And when you look at the research on the MRI, it's not great. I mean, I was shocked when I was going through all my training, and we were literally like, I would like pull research after research after research, and they were saying really very similar things. You could take 100 people with like no pain whatsoever, fully functional, can do everything, no problems, and 60 to 80% of them are going to show something. And this could be a rotator cuff tear. This could be a meniscal tear. This could be a back herniated disc or degenerative changes that are happening, or stenosis. It could be any one of these things. And I can share like a recent story that we had. We literally had a person that came in, and she was on the books to like have a rotator cuff surgery. And when I spoke with her, I was asking her a few questions, like what else did she try? And literally she had tried physical therapy, but all they did was focus on the shoulder. And they just gave her basic shoulder exercises, and it didn't work. And so the doctor's like, well, the MRI shows that you have a rotator cuff tear. Let's just go ahead and have surgery. So it was on the books for it to happen like in 3 weeks. And I'm like, let's come in, let me see it, because there's a lot of times what I tell people is where the site of the pain is not often where the source of the problem is located. And had anyone ever looked into her back, her thoracic spine or her neck? And no one ever did, but she was saying she'd been having pain there for a really long time. And I'm like, we need to address that and just see. And she couldn't raise her arm up very well at all. And we worked on her, the first visit she improved, the second visit she improved. By the third visit, she literally canceled her surgery because she was like, I don't think I need this anymore. And that was 6 months of their life, like 6 months that we were able to give their life back, because rotator cuff surgery is horrible. And that was based off the MRI. And so that's why we have to like, okay, we have this MRI, but let's see if what's in it is really true. And I like to always give the analogy, an MRI is just a picture, and it's a picture where we're lying down and we're not even moving. And usually when we're still, it's like we don't really hurt, but it's the movement that gives us some problems. And it'd be like taking a picture of a telephone that's not working. And can you see if the telephone's plugged in? Is like the receiver part of it plugged in? Does it even have like a telephone service that's going to it? You don't know in the picture. You have to go and actually sit and assess it. And that's kind of what an MRI does. And that's why a lot of times MRIs will lead into unnecessary procedures, because it says, oh, this is the problem, this is where your pain's located. But again, like I always tell people, where the site of the location is often not where the source is. And we have to figure out where the source is. So let's get into why medications and injections don't always work. So we feel pain in 3 different ways. We feel pain with chemicals, we feel pain mechanically, and we feel pain thermally. So thermal pain would be like burns, sunburns, those kind of things. And so let's like kind of throw that off the table. So chemical pain would be like that inflammation, like you had that injury, those chemicals come in, it's that throbbing, aching, constant pain. Typically you can't change your position to make it better or worse. It's really inflamed. So chemicals can treat chemicals. And, but what chemicals can't treat, so like drugs can treat the chemicals, because a drug is a chemical, an injection is a chemical. But what it can't treat is something mechanical. And something mechanical is just an imbalance that's happening, or something that a mechanic like us, a physical therapist, if you find a good one, we're a good mechanic of understanding the body and where things are going wrong. You can't throw drugs at that. And typically when it's mechanical, it's going to be The pain can come and go. You can't have constant pain, but a lot of times you can find positions that can reduce the pain. You can change your pain. You can tell me what makes it better, what makes it worse. It can come and go. Chemicals don't come and go. Like when it's really, truly chemical and you have that inflammation, it's that throbbing, achiness, those kind of things. It doesn't just go like, oh, I feel fine. Oh, I'm throbbing and aching. Oh, I feel fine. It doesn't work that way. And so when you notice, like questions that I love to tell my patients to look for is, if you can change your pain by different positions, that's mechanical. And if you throw a drug at that or an injection at that, it's not always going to work. It may take the edge off, but you're going to be like, I still feel the same. Like, I don't know, like it didn't really work for me. And you'll hear that a lot with people that do injections. You'll hear that a lot with people that take medications, like it just takes the edge off, or it didn't really work for me. And those are really, really common. And so when you have someone that gets an injection, when you really look at the research, and this is another thing that I was like so surprised, and I was looking at research after research after research, a lot of times doctors will give people injections and they'll feel great for a period of time. And if you look at the research, like after 6 weeks, a lot of times the pain will return. Sometimes it's in 1 week and sometimes it's in 8 weeks, but a lot of time the pain returns. And the reason why is kind of leads me into kind of the next conversation that we'll be in, is because you don't even know what you did to begin with. So a lot of times when we get patients that come into our office, we're not really sure. You ask them, what happened? Oh, I'm not really sure. I just kind of woke up one day and started hurting. Or I kind of started getting this gradual pain. Now it would come and go, and now it's like there all the time. That's typically what we get for the majority of the people. And those are things that usually are fixable. Like if you get to a good person, they're going to know exactly what to do with you. And so that's where we get into kind of that lifestyle of what you're doing that's creating some of the problems. So if you get the injection and you're like, my pain's gone, I'm going to go back to everything at 100%. And I hadn't been able to do it for like 6 months, but I feel good now. And then all of a sudden you hurt worse later because you never got to really figuring out truly what was going on and what you were doing throughout the day. And that leads me into kind of that next piece of it is, what most healthcare providers miss is the fact that, because we aren't sure what we did, there are things that we're doing throughout the day that's creating some of our problems. And when you look at even, backs or hips or knees, it can even be like necks, shoulders. You're doing stuff throughout the day that could be basically causing problems. So it'd be like stabbing a wound. So every time you did certain activities, it's like, oh, I have a really hard time with that. And it's like stabbing the wound. And so people will have this back pain that can last for, a year, 5 years, 10 years. We've seen it all over the spectrum. And, but we've also seen all over the spectrum get better. And one of the big things that we do is bring awareness. Once we start asking questions and really understanding kind of what's going on. And some of those questions are like better, worse questions. What makes you feel better? What makes you feel worse? These are questions that we ask all the time and really kind of start digging deep. And even when people don't know, we'll be like, well, how does it feel if you're walking? How does it feel if you're sitting? After you sit for a while, can you stand up? Or do you feel like you're 80 years old because you can't straighten up? So we'll get into some questions like that, but they give us an understanding of the body and the positions of the body. So we'll start finding patterns that, every time you're flexing and doing these things, it's making it worse. And so then we can start going into, okay, so we're going to go and try a few things, get some baselines. So we get baselines of range of motion, we get baselines of strength, we get baselines of maybe something functional that doesn't feel so good. And then we move you in a direction and then we retest those baselines. But based on having those conversations, we'll know which direction we need to move you in. And that's what we'll do. And then we'll notice that these baselines will get better. We can notice that they get worse, and we can notice that they stay the same. Either way, it doesn't matter because it just gives us information as to how the body responds. And once we figure out the direction that we need to go into, then we can start talking about, okay, we can talk about the things that make you worse and how we can avoid some of those things or how we can modify those things or just bring in awareness. So like, for instance, a lot of times with the back, things that will bother people, and this is not everyone, there's a lot of different kind of patterns out there, but this is a common one, is you'll notice, people will notice that if they sit for a while, like sitting may feel okay, but then they'll stand up and they just can't straighten up. And so they look like they're 80 years old trying to straighten up and stand up. They may notice that like walking feels so much better, or that they feel much better when they're standing and working. They may feel better like lying flat. And so we start putting these patterns together, or they have a hard time bending down to like kind of tie their shoe. So you'll start finding patterns in their movements, like the bending is the problem, and the when they extend, it actually feels better. So it's like walking is like little mini extensions. They feel better. So we know that, okay, we might need to be moving in those directions, or they lie flat and it feels so much better. We know that we need to be moving into some of those directions. And so that gives us information education. And then once we know, then we can start giving you really awareness around things that you're doing throughout the day that are causing some of your problems. And that's huge, because that's going to help us not like stab that wound. Especially with the back, like the way I describe it is, it's like if someone sprains their ankle and you go in and you twist that ankle to put pressure on those ligaments, that hurts when you do that because it's damaged. Well, there's parts of the back that can be damaged. And we don't even know, it's based on like, you can be damaged anywhere on that disc. You can be damaged in the front of the disc, the side of the disc, the back of the disc. But if you're doing things that puts pressure into those areas, all of a sudden that's where it hurts. And then what happens is the muscles will tense up and protect. So often we want to go and do all this soft tissue and manual release of these muscles, which there's some things that we do that with, but we do it once we know which direction we need to go into. But if you only go into the soft tissue, the reason why it comes right back again, where you start hurting again, is because you're treating the symptom. And if you get down to the root cause of what it is, those muscles will just like literally like will melt away. And it's like, oh my gosh, that tightness, it doesn't feel tight anymore. And that's part of like where we tend to kind of treat the symptoms in the healthcare system versus like really getting down to the source. But yeah, bringing awareness around like the things that you're doing throughout the day really makes a big difference in that healing process. And so we'll go into kind of the last piece of this is why surgeries, especially for the back, why the back surgeries will lead to a second surgery and a third surgery and a fourth surgery. And I have a great story to tell you guys on this too. But the main reasons why it leads to more surgeries is that they go in, and a lot of times they'll do like a laminectomy, a discectomy, those kind of things, where they're cutting out the piece or open up the space or whatever they're doing, where everything is kind of irritated. And so then they feel great because they've taken the irritation away. But what happens is, because they don't know what they're doing throughout the day that's creating the problems, they go back to the same habits, the same postures that they go into, whether it's a sitting job or they're always, whatever it is that they're doing, they don't get education as to what they're doing throughout the day. So here it is, after 6 months, 8 months, a year, they start having some of those problems again, because this was a gradual thing. They weren't really sure what happened to begin with in the first place. And then they go have the surgery, and then all of a sudden it all comes back again. And then they say, oh, yeah, well, that's usually what happens. We knew this was going to happen, but we always like to start conservatively. So now we're just going to have to go in and do a fusion. Like, this is the conversations that we have. And I'm like, no, stop the madness. No, there's so many things that we usually can do. And rarely do I send people to having to have surgery because usually we're able to resolve their symptoms. We had a patient literally, I think it was probably like a year ago, and he went to the doctor, and I mean, he was a good doctor, and the doctor asked him, how long have you had this back pain before? Yeah, I've had it before. It just keeps on coming back. And he said, have you tried therapy? Yeah, I did therapy last time before, but, maybe it'd been a while since he had done it. And the doctor goes, well, you've already tried therapy. Your MRI shows this. Let's just go ahead and have surgery. So he was in the waiting room, and in the waiting room, he literally was around all these people and was just asking, is this your first surgery? And almost every single person in the office, it was their second or third surgery. And he was like, holy crap, I don't know if I want to do this. So he goes into the room, into the surgery room, and the nurses ask, what is your pain level? And he says 0. And they looked at him like really weird, like, 0? You don't have any pain? And he goes, no, I never have pain in the morning. I told the doctor I don't have pain in the morning. My pain gets worse as I go on when I do my activities. And so when the doctor came in, and because of the nurse's expressions, he was like, I'm done. I'm not going to do this anymore. And happened to find my office and came in. And I literally think it was like 6 visits. And he was like back to 100% doing everything. And he literally was going to have surgery. And we get stories like this all the time. And so it's when we get into some of these procedures and MRIs and things like that, it leads us into these procedures. And some of it's not necessarily always the doctor's fault. It's just that, you know, the way our system's set up, we have less and less time with patients. We don't, the way we set our office up, we have plenty of time with our patients. We spend as much time as we need to with our patients. Everything we do is all one-on-one. And people, you know, can spend an hour with us or longer if they need. But with doctor's offices, they are like in and out so fast. And so all they do is basically, you know, talk to you a little bit. Where's the source? Maybe move you around a little bit in like 3 minutes. And they look at the MRI and they say, yep, this is what it is. You can try some stuff on your own. Here's some exercises, which is like ridiculous because you don't even evaluate to know like what you need to really give them. And they send them on their way, and then they come back and it's like, yep, it's about the same, and they decide to have surgery. So that's usually the route that people go on. So anyway, I'm gonna kind of stop there. There's a couple of options. We have some really cool things because we know we have some craziness going on within like the coronavirus and all this stuff that's happening. So we have, we've been doing some of these things for a while, and we're probably like one of the only few physical therapy offices that kind of offer this, but we have several things that are online. So we do telehealth services now. Well, we've been doing them for patients that literally like live too far away from us or and wanted to come in and us take a look at them so they can get some education, knowing what to do. So a lot of what we do is just really giving you the tools so that you can help yourself, so that you know exactly what to do. And we're basically kind of the coach of your body. So, so telehealth works amazing with some of the things that we do. We also have an 8-week course that we put together for backs. It's probably we'll have like, 5-6 people in it. We're going to keep it small. But we're going to do it all online. So it'll be just like this, where you'll actually get to see us talk, and we'll go into a lot of education, and you'll get information after each visit. You'll have emails with exercises. You'll have, contact points with us where you can ask us questions. But we have an 8-week course to basically take someone to start moving them to where they can start working on strengthening and feeling confident with where they're going. And then our last thing that we have is, we can sit down and even talk a little bit more, and I'll take this off of mute here in a second. But we have discovery visits that we offer people where we can sit down and just talk one-on-one, and we do those free for people that are really serious, that think that like, yes, this sounds great. I think this is something that I at least want to explore. Doesn't mean that you have to say yes to this, but at least want to explore to see like I'm just sick of where I'm going. The people that we typically see are people that have tried everything. They've tried, multiple healthcare providers, from, chiropractors to PT to massage therapists to acupuncturists. I mean, they've done it all. And we get the people that have had failed treatments. That's the typical clientele that we have. And we really try to help people avoid the surgeries and injections and medications and all those kind of things. So with that being said, I'm going to open it up. So if you have any questions, then we can get those answered.